that's, I think, an opportunity to really push hard on this. And finally, the two other areas that there are real opportunities here, I think, are in the local action, and I'm looking forward to hearing about what's going on in Buffalo, but there are many other cities where the local government has taken a leadership role. Obviously, it's helpful to have state and federal money, but some local governments, some mayors have really stepped up to the plate. Some local water utilities have really stepped up to the plate. So there are real opportunities at the local level to move forward. And finally, I think critically, citizen action remains absolutely central to being successful. So we're not going to see any of the above. We're not going to see success with infrastructure legislation. We will not see success at the local level. We won't see success in any of these endeavors if local citizens are not engaged, are not educated about the problem, and concerned about it. And I think that goes to all of our effort to try to get people in our communities knowledgeable and engaged on lead poisoning issues.
Erik, thank you. Sharon Linstedt from the city of Buffalo.
On behalf of my mayor, who is under the weather and is very disappointed he couldn't be here, I want to thank you for inviting the city of Buffalo to take part in this. It's exciting to be in a room full of people who understand that lead is a significant problem in our municipalities and across the country, that lead poisoning is 100% preventable, and that we're here today to make that commitment that within 5 years, we do not want this to be a problem, and we're going to work toward that. To tell you a little bit about the Buffalo experience, the majority of our housing stock, commercial buildings, public buildings, are old, many decades old, and I think the average age of our year where houses were at their peak of building was about 1945. So we have a significant lead-based paint problem. And we also have, as an older city, a water delivery system that includes lead service lines as well as plumbing connections. We could sit back and just accept lead as a fact of life, but we can't do that because we're poisoning our children by doing that. So our mayor, who is he's in his 11th year as mayor, so it's the heading into the final year of his 3rd term, has taken lead very seriously. We talk about lead. It's a word we say out loud. And we have been working, especially in the past 12 months, to make legislative changes, communication changes, and collaboration changes, realizing that the city of Buffalo does not have the full tool set to deal with all the various issues. With the backing of the mayor, the common council, we are working in partnership with the Buffalo Public Schools, with the County of Erie, which has an excellent health department and is just been so gracious in helping us do testing. The Community Foundation for Greater Buffalo, and the Green and Healthy Homes Initiative. Our goals are to legislate, collaborate, educate, and remediate. One of the reasons I'm sitting here in place of the mayor is we realized that to address lead, it really went beyond the Department of Permits and Inspections, that it really became a matter of communications. If people don't know what we're doing, if they don't know the dangers, if they're not aware, if they're out of the loop, we can't find them, we can't help them, we can't tell them what we're doing, we can't get them to buy into this greater issue. So one of the things that we've done is a revamped lead education flyer, and I'm very happy to say that by the end of the year we will have distributed over 100,000 of these. And just last week we got some additional translations. We're now in 8 languages, and we now are in Arabic, and we're in Karen, we're in Somali, and Burmese. And it's really exciting to be able to hand these out to the communities, especially our burgeoning refugee and immigrant communities, where they have so much to learn about life in the U.S., and to learn about lead it's just very key. They're our most vulnerable part of the population. We have a 311 system for residents to call with issues. We've created a dedicated lead line for 311, so those calls are triaged, and calls regarding water go directly to the Buffalo Water Department for follow-up and testing kits. If it's about lead paint, immediately diverted to our housing inspectors, and we're increasing the ranks of our housing inspectors and getting them better educated to deal with these situations. And we've been getting good results on that, not only spotting exterior peeling paint, but people who are willing to invite us into their homes and show us what's going on indoors as well. So that's been fantastic. We're putting special emphasis on 3 zip codes in our inner city where the highest blood level of lead have been recorded and are consistently recorded. And through the help of our partners, we now have 28 billboards, 170 bus interior ads that will be running through January, and then we're going to renew for another 3 months to give basic information on a call to action. Call 311. Someone's going to be able to help you. And we've been getting calls, which is just great. On the legislative side, we have toughened up rules for landlords, property managers, and those obtaining renovation permits. Landlords on the city's rental registry now must certify that they're aware of their property's lead levels and agree to follow the federal guidelines for renovation and repair. Property managers are required to complete the EPA-accredited renovation repair training program. Landlords have to disclose to their tenants that there is a possibility of lead in the property, and certificates of occupancy are being denied if there is a lead paint hazard. So we're tightening the screws on them. We're also doubling the annual fee of our rental registry to be on the rental registration rolls, and that's key because that also loops people in to get Section 8 housing, and so people want to be on these rolls. We're doubling the fees, we're dedicating that extra money to lead efforts, and that will start on January 1 when the next fees go out. We're also working with our nonprofit partners to harness the expertise of 2 veteran organizations out of upstate New York. We are trying to develop a data-driven master plan that will guide our efforts and also quantify our progress. Buffalo is about to launch an open data effort, and one of the things we want to get up online is where we are in inspecting houses and water tests, and so we have transparency and more information out there. We recently completed independent testing of 150 samples collected across the city. We're really lucky. We live on the shores of Lake Erie. We draw our water. It is a wonderful, non-corrosive water source. It's easily treatable. We take the extra step of adding phosphate to the water to cut any additional corrosion. And we were very happy to find that of those 150 samples, there was either no lead or lead far below the 15 parts per billion. But we decided to hold ourselves to the higher level of 5 parts per billion using the FDA standards for bottled water. Out of those tests, we had 7 that came up just over 5%, or the 5 parts per billion, I'm sorry. We have worked with those homeowners and tenants. We've replaced water lines, and where water lines have not been the problem, We are working with the homeowners and tenants to see what's happening in their homes. We're also in the middle of an inventory of all 170 city-owned buildings. We're starting with the general water sources in those buildings, and we should have all of our findings back by the end of the year. We wanted to set some goals that we knew where we were at the end of 2016. So far, we have 46% of those tests back, and they're coming back wonderfully so far. But anything that comes back with any outlying numbers, we're going to go back in, and we're going to be checking all of the water sources in all of those buildings and making whatever changes need to be made. And we are concentrating heavily on community centers, youth centers, and our Buffalo Public Schools, under a state mandate, have also undertaken a full inventory of water tests, and they're working very hard. So we could not do this without the partnerships that we have formed, and we hope that we can provide a model, a mini model of how we can all work together, drop our barriers, commingle our funds, help leverage to get more funds. And so far, it's been working very well, and we want to make a lot more progress.
Sharon, thank you. It's really inspiring to hear what a city can do when it has the leadership and the will. So Peggy Shepard, as I said before, is the founder and executive director of We Act for Environmental Justice in Harlem.
Yes. So hello, everyone. I think this past election season has really taught us the lesson of creating the political will. And that's really what we have to do here through collective action. It's been at least 25 years ago that there was a raging debate in Congress over abating lead-based paint in homes. And Dr. Herb Needleman suggested spending $10 billion to abate 2 million homes. That consensus did not happen, and so we went for a very targeted approach. But instead, we find that the federal government is spending $11 billion on new prisons each year. So what we have is a very racialized approach to a culture of health. We have a racialized approach to lead poisoning prevention because the majority of children of new cases are children of color. We know in New York City, 92% of all new cases are children of color living in 10 identified neighborhoods. About back in 2004, we had a New York City coalition to end lead poisoning. We passed one of the most protective lead poisoning laws in the country, and today we're realizing that we've got to go back to court, we've got to go back to the mayor, because that law is not being, enforced. So even when we do have regulation, we have to have the coalitions and the monitoring in place to ensure that what we thought we had gained is actually being effective. So how do we develop the collective action that we need? We've got to build the awareness in the most affected communities. We can collaborate with community-based organizations and faith-based groups to deploy community health workers. More departments of health are using the Promotora and community health worker approach to really focus on the most affected neighborhoods and the most affected populations, many of whom are new immigrants in many of our cities as well. A small increase in the HUD lead hazard control money could put thousands of people to work in communities around the country and working in their own neighborhoods, which people are very motivated and passionate about doing. And then how do we really develop primary prevention? And to do that, we've got to have robust programs. Community-based workforces, again, can help kick the lead out of our communities. Lead-safe houses have proved to be very important in New York City because so many families, or so many children, are re-lead poisoned during the abatement process by workers who are not certified and don't really know what they're doing. So we can have programs that train and employ low-income community residents, including the parents of lead-poisoned children, because we realize that we all care about kids, but we only care about our own kids. And I think that has been a problem throughout the whole children's environmental health field that many of us here have been working in over the years. We know that we need so much job development, and that through small business development and other kinds of social entrepreneur investing, that we can build the workforce that can begin to do the large amount of abatement that we need. And we've heard the President-elect say that he wants to invest in infrastructure, but we've got to ensure that all of the rebuilt infrastructure is lead-free. We have our bridges that are constantly being abated, where community residents, houses, playgrounds are being poisoned with lead dust from that kind of abatement. We shouldn't have to fear that our water pipes may poison our families. So there's a lot of work for plumbers and contractors and labor. Again, if we make the investment to ensure that our infrastructure is lead-free. We've also often thought about how the banking world really thinks about community development. And they often think that community development is about building affordable housing, but it's also about preserving and maintaining healthy housing. We have a Community Reinvestment Act that's been used in very usual ways, again, supporting housing and other kinds of cultural activities in communities. But why not begin to work with the banking world to really use some of those funds to invest in healthier housing? We've also been thinking about how the Affordable Care Act mandates that there are community benefits from the large hospital systems. And a lot of hospital systems may think that a community benefit is another brochure about high blood pressure or heart disease, when in fact they could be investing the millions that many of them are generating in revenue in our parks and open space and in healthier homes, or mold abatement and lead abatement in the neighborhoods in which most of these hospital centers are based. They are based generally in neighborhoods that are underserved and underinvested. And just to end, I would say that our laws on rental housing vary from state to state, municipality to municipality, and we really need a federal law that governs the sale and rental of homes, that not just the owner says, signs his name and says, I've signed an affidavit that this is lead-free, but that there's actually an inspection to certify that that apartment or that home is lead-free. And that, again, is really not happening around the city. And lastly, but not least, is organizing. How do we build an inter-sectoral approach? How do we work with, for instance, in New York City, we've joined a number of affordable housing coalitions, because those groups are very involved in housing and tenant rights. But they're not thinking so much about what they're calling repairs. And they're not linking that as much with health. And so we've joined those coalitions so that we can bring the environmental health lens to housing activism. And so I believe that through collective action, inter-sectoral approach with government, the health field and health organizations, as well as environmental and the financial world, we could really begin to create a culture of health and to make a difference in the lead prevention field and issue.
Thanks, Peggy. So I will ask a first question, but now's the time to send in your questions via the Sligo pull, or obviously there's mics available as well on the floor if you want to ask a question that way. But let me just start by kind of synthesizing what all four of you have said. We have two people, Charlotte and Erik, who are working with national organizations on policy, sometimes at the federal level, sometimes sub-federally, but you both mentioned the importance of being grounded in partnerships with community groups. At the same time, we have in Peggy and Sharon two women who are grounded very firmly in their communities. Peggy in an advocacy and social service organization, and Sharon in government. Is there, and you all have described or mentioned the importance of community-based activity. Is there anything that any of you would like to say to go a little deeper on that? How, as we begin to think about this coalition that could be forming up, that may have a national level and then many local satellite entities. I'm just sort of making it up here as I go along, but the question being, can you talk a little bit about ways in which, from where you're each sitting, how your work can be augmented and assisted by working both with community groups or with national groups? How can these two levels of organizations begin to come together?
I mean, I can start if somebody else wants to. I've been engaged in several coalitions that have national groups, regional groups, and local groups. And they can be challenging because of the logistics of making all that happen. I think it's really important, though, to have success, to have the national groups and the local and regional groups engaged. And that requires funding, usually, and it requires a willingness to collaborate that sometimes can be there and sometimes is not there. And I do feel like in the lead arena, there have been some divisions within the lead community. Some people work on paint, some people work on soil, some people work on drinking water. And I think having that full array of people at the national level and at the local level is really critical. And that's going to require, I think, maybe some support from the funding community to actually make it happen.
Yeah, I certainly agree with that. National coalitions can be difficult, but they're necessary when we're focusing on federal agencies and federal investment. But local coalitions are so important. When we first started working on the local lead law of 2004 in New York City, I remember walking into a room and I think NYPIRG was leading it. And I walked into the room and it was all white advocates, professional advocates. And, you know, I thought that it was an important issue for us to begin working on. And we were flying in people like Bruce Lamphere, who was here earlier, and major pediatricians from all over the country to stand on the steps of City Hall and talk about, you know, the lead poisoning risk to children. But it wasn't until we just took a look and said, we've got to organize parents. You know, my Harlem elected official wanted to know why, you know, white folks from downtown were coming to his office about lead poisoning. He wanted to know if it was an issue in his community, why wasn't he seeing parents and community leaders from that community? And so we began a different organizing campaign to get parents informed, able to speak to their elected officials, able to tell their stories, and it made all the difference. And we were finally able to pass a very strong law, which again, as I said now, needs to be monitored. And if you don't have that coalition in place, for instance, one of the leaders of our coalition, Matt Sharon, who's an attorney who would really hope to have been here today, but he's in court. You know, he called the coalition up a couple of months ago and said, I've just found out that the city is not enforcing the law at all. So what are we going to do? So we've developed a variety of strategies to, again, go back and begin dealing with the city and the city council on this. So local coalitions are very important, but they've got to be diverse. They've got to be constituted of affected people.
I agree with that. I would also add, and they have to be transparent. So, you know, if all organizing is figuring out what do you want, who can give you what you want, and how do you get them to want to give it to you, then the importance of the people who elect them need to be in the room so that they can get reelected, which is what many elected officials want. It's not because it's nice. It's because it's necessary. And you know, I've been part of many coalitions that labored and agonized over everybody making every decision together, no matter how obvious the decision was going to be. And I will just vote that, you know, how many of you think that's a total waste of time? But I've also been part of coalitions where all of a sudden funding decisions happened and nobody knows where that decision got made. We were just, you know, we were discussing what color of blue should be on the logo, but somebody else was deciding where all the money should go. That's not a coalition. So really, having the kind of collective leadership that understands that money really matters and transparency on money matters, and that big decisions need to be held by the group, but not because you kept everybody on the phone for 6 hours, is, I think, a really essential part of how we do this.
Sharon, do you want to add anything?
Well, I think from Buffalo's experience, we know we have a city problem, we know we have a county problem. It turns out we have an upstate New York problem, a New York City problem, because we have older cities. But we can do our own thing, but it also can't be piecemeal, because this is not just a New York State problem, it's a national problem, which all of you recognize. My boss, whose day job is being mayor of Buffalo, but who also has this interesting side job as being the chairman of the New York State Democratic Committee, is trying to find something good out of the election, and he really wants to just pound away on infrastructure, and any decisions made on infrastructure to link that to water lines and to structure, and not let go of that. And for that, we need a united voice that goes way beyond City Hall in Buffalo and across the country. And if we can hold the president-elect to his repeated comment that we're going to have this great infrastructure that's going to make America great, well, let's make our water systems great, and let's use this for lead abatement, and see if there is a sort of a hidden good thing here.
Well, and thank you all for those comments. In the meantime, we've had a tremendous amount of questions that are getting occluded into our pipelines here. So let me take the first couple. And there's one question about the nature of a coalition that we all might be getting involved in. And then there's a question about individual action. And the first question gets, the question that's getting the most likes is about individual action. So I'll just read it quickly. Is there a single, simple, effective task all of us can do when we leave this conference today? Ideally, it would be a concrete first step toward the goal of eliminating lead poisoning in 5 years. It would also hopefully serve to forge a connection between all of us here. So anybody want to take a stab at answering that? Erik?
I'll start. I mean, Senator Stabenow spoke midday about this. I think something that's immediate and pressing and urgent is to ask your elected representatives to take action on the pending bill that's going to have to move probably this week for funding infrastructure, not just in Flint. The Senate bill would fund a lot of other water infrastructure, as well as take some other really important steps. That Senate bill is much better than the House bill. So that's one thing we could all do today or tomorrow. Talk to your senator's office and talk to your House member's office. But I think the longer term thing that we really need to do is figure out a way to capture the energy in this room and capture all of the expertise in this room and from so many other places. And I think Peggy's point is so important, that having local voices be part of this that are representative of the communities that are most affected is so critical. I'll just say, from my experience in working in the Senate, there is nothing more powerful than having people that are actually affected come and speak to elected representatives. And they have to be from their congressional district or from their state. Experts are interesting, but they don't move policy. And telling your own story and delivering that message is so critical to moving policy that really almost nothing else works.
And I think that if every single person went home and did an assessment, is your apartment, your house, your child's school, your child's daycare center, are any of those in facilities that might have lead, that were built after 1974? Do you see any peeling lead paint? I'm just talking about paint right now. Any peeling lead paint in any of those facilities where you frequent or take your child? And say that to your neighbors and to your friends. I mean, that's one, I go into facilities and I'll see peeling paint and, I make a point of mentioning it. Sometimes it's a government agency, actually. But I think that if we are each and every one aware and make our friends and neighbors aware, that is a place to start. And then we can begin to also look and see if there is a coalition or if there is advocacy in your neighborhood or in your town, or you can go talk to your elected official about what he or she is doing. And yeah.
Well, one tangible thing that we could do is to sign the call to action that I think is outside, and hopefully many groups are going to be able to join. But I see a question that's a bit of a contrarian question, but it deserves a response. What can the signed call to action poster really tangibly accomplish? So Charlotte, as one of the steering committee members who developed the call to action, maybe you want to give a short response to that?
It's
then we'll
symbolic.
Go back. Yeah.
But it's symbolic of a aggregation of the 120 things that need to happen to actually eliminate lead poisoning. But it's meant to give us a simple framework of how we get there. And it's also meant to be visual, right? So the idea that it would become one of the documents in a larger document about what we're trying to do. So please sign it. The Declaration of Independence, those signatures at the bottom, actually, I remember them, right? And the John Hancock big one. It's symbolic, but it's meant to be symbolic of creating, of what we intend to do coming out of this summit.
And if you did that in every level. Sorry, what?
Good afternoon. I'm Sandra Howard. I'm an environmental health advisor to the Assistant Secretary for Health at the U.S. Department of Health and Human Services. And along with Ruth Edsel from EPA, who was here, but I gather maybe isn't right this minute, though she has representation here, I co-chair the Senior Staff Steering Committee of this mouthful, President's Task Force on Environmental Health Risks and Safety Risks to Children. It's been mentioned before as the task force, and also referred to when people talked about a strategy that was a federal strategy that was released in 2000 to end childhood lead poisoning. And I want everybody to know that this summit has been fabulously energizing. The task force made preventing childhood lead exposures its priority, one of its top priorities going forward. And we are now starting to work on a new federal strategy. Now, the federal government, as we know, isn't going to be able to do everything, but we definitely will be working together with our partners. We have HUD here, we have EPA here, CDC was here earlier. There could have been some other members of the task force agencies that I haven't called out, but I want you to know that this call to action is beyond symbolic. This was very energizing, and I'm very glad to see that there's so much enthusiasm for moving forward in this new environment. People believe this can happen, and we believe it also. So I want to thank you very much. We are listening to the recommendations that you've made, and I know some of us will continue to be in contact. So thank you all very much.
Thank you. Well, we have to close out. You've got the clock ticking here. So we have two other groups of questions. We're not going to have a chance to have a panel respond to them because each panelist has been given a minute for a closing statement, but there's clearly interest and curiosity about how a bigger coalition would work. And so for those of you who want to talk about the coalition, get involved in that perhaps, think about funding it. There's another question. I just invite you to talk to any of the panelists here or anybody else on the steering committee. There are also a set of questions to Charlotte about, I'm sorry, that was the coalition question. A set of questions to Sharon about Buffalo's experience and which people are obviously finding intriguing. So again, I would invite you to, after the session closes, to talk to Sharon one-on-one. So with just a couple minutes remaining, I'd like to ask each one of our four panelists to give us whatever closing thoughts or conclusions you'd like to offer up. And we'll start with Charlotte.
Okay. So this morning I welcomed you all by quoting my friend Paul Wellstone, and I thought I would end the day by doing that as well. The future will not belong to those who sit on the sidelines. The future will not belong to the cynics. The future belongs to those who believe in the beauty of their dreams.
Very good. Peggy.
Yeah, I would just say that we all have to take action in the spheres in which we work. Our voices have to be loud and often and consistent, and we can win with that kind of collective action.
Sharon.
Well, I want to go back to my mayor's hope that the president-elect repeatedly pledged that the new administration will address the country's vast infrastructure problems. He also said that he pledged to improve the lives of people living in inner cities. Lead remediation, lead elimination goes hand in hand with both of those. I think that we need to stay in touch with our federal lawmakers, keep talking to them about making lead part of any kind of infrastructure grand plan, and also as part of anything that involves improving the lives of people living in inner cities. And Buffalo has a great issue with this, and I mean, it's so great to be in a room of people who want to work together toward that goal.
Erik?
Well, I would say that I'm energized by seeing so many great people in this room, and I think we should all feel like there is a real opportunity here to restart the movement on lead. There really is a tremendous amount of energy and effort that we could go forward with. I totally agree with the notion that we have to dream big here. I think we need to dream that we really will fix this problem in 5 years, and that if we make a true investment in that and we stick together and we have a real movement and a coalition, we can actually make a huge dent in this problem quickly, notwithstanding the macro politics here. I think all politics are local, and we can mobilize things by pushing at the local level on up to the national.
Great. And with 3 red zeros here, I'll only say I look forward to getting back here together in 5 years with all of you and many more to celebrate the successful end to childhood lead poisoning for all children. So thank you all very much.